Anorexia nervosa is an eating disorder. It is categorized as one of the most common eating disorders. When we talk about anorexia nervosa, it is most commonly seen in women, but it can also be seen in men. Now, when we talk about the onset of anorexia nervosa, it usually occurs in the teens or early age. Usually, the person with anorexia nervosa experiences difficulties around food and their behaviors around food, their thought process around food. So the most common thing or the most common thought process is the fear of fatness. The pursuit of thinness is something which they strive for. They feel even though they would be below the normal body weight for their height, they feel that they are fat and they want to do exercise, they want to do certain behaviors which will help them maintain a body weight which is apt according to them and not according to the guidelines. So when we are talking about anorexia nervosa, certain things which one can see in a person who's experiencing these symptoms is starving themselves, is excessively exercising, is not eating in public, is using some compensatory behaviors like using medications, using vomiting as an approach to maintain a body weight which is apt for them. There can be coexisting illnesses which can happen with anorexia nervosa. A lot of times a person can experience depressive symptoms or depressive episode, anxiety symptoms or anxiety episodes, and it is very important to take help for all these symptoms and episodes. Now, when we are talking about taking help, either you approach a psychologist or a psychiatrist. The treatment approach should be a multidisciplinary approach. It cannot be just with a psychologist or just with a psychiatrist. When we say multidisciplinary, it just does not include a psychologist and a psychiatrist. It also involves a general physician as well as a nutritionist. So all the team members, which is a psychologist, a psychiatrist, a nutritionist, and a general physician, are going to together help you with the treatment. An important part of the aspect of the treatment is also the family. The family also needs to understand, also needs to get the understanding of how they can help, what is their role in the treatment aspect. So when we are talking about anorexia nervosa, a very common illness, this is something which requires treatment, is helpful when you approach a mental health professional who can guide you as what the treatment is.